Hello, everybody. Welcome to this podcast episode. Today's episode, we have again a recurrent guest, Dr. Don Tillery, oral maxillofacial surgeon. Today, we are talking about dental tooth trauma. And I got to intro this by getting into a little bit about what you do. I'm going to kind of brag on you a little bit. Most people, probably at least when they ask me, they refer to an oral surgeon. And so I just want to preface something because this is certainly important to today's topic. Your training is OMFS, and what that stands for is oral and maxillofacial surgeon. And the reason that's important is because you guys do a heck of a lot more than just take out teeth. You train at Parkland, which I know is a very intense, you called it the knife and gun club. I mean, it is a hardcore training program. I'm pretty sure it's one of the best programs, if not the best program in the heart of Dallas. And you guys train pretty much from the eyeball to the neck. I mean, you guys do fractures of the face, the jaw, the nose. I mean, a lot of stuff. And so anytime somebody throughout this or sees this video and sees what OMFS is, it's important to plug in that it's oral maxillofacial surgery. There's a heck of a lot more going on, and that's why I love that you're my guest today, because with trauma, it's not always localized to the tooth. Clearly, sometimes there's jaw and other issues. And so let's get into the first question. If I'm a patient watching this or I'm learning from this, how do I know if I just had a facial trauma? How do I know how serious it is? How do I know what to do? And what's the first thing somebody should think about?
Sure. Well, obviously, if you're on the basketball court, you see somebody take an elbow to the face. If you're their parent, this is often the case. The first thing you want to do is check their level of consciousness, make sure that they don't have any neurological damage, and you might at that point have an opportunity to check their ability to respond to questions, and those are the things that are the most critical. Now, certainly the next thing that you will want to do is if they're bleeding somewhere, if they have some obvious bleeding from inside their mouth, that's going to give you a clue. Some of the questions that I'll usually ask a patient who sustained trauma is, do they have any numbness in any parts of the face, in the jaw, the lower lip, the chin, side of the nose, the cheek, or even up into the forehead? The nerves that innervate those parts of the skin exit through little holes in the skull that are called foramina. And those foramen are the areas that are very susceptible to the track of a break, of either the cheekbone right below the eye, which would result in numbness here in their area below their eye socket of the skin. Their lower lip, chin, and or tongue is a very classic identifier that a person might have a jaw fracture. Subjectively, in other words, the person might report that they have numbness, and they might report that their teeth don't fit together right. Or they may report that they're missing a tooth or two, even though no tooth can be found on the scene. Those are classic indications for a more intense skeletal evaluation, and one should seek some professional care for those cases. Obviously, if you are looking on the floor of the gym or out on the home plate of the baseball field and you find a tooth that's been knocked out, a very important part is to gently wash that off. Try your best to replace it right in the area where it was lost, before you can seek good comprehensive care for that condition. Timeliness is pretty critical in those cases.
Yeah, and I appreciate you prefacing the level. I mean, I should have mentioned this. We're not talking about people getting helivac'd out and a car accident. We're talking on a scale of things, more minor injuries like a baseball to the face or a basketball to the face. You're conscious. Clearly, if you're laying on the ground unconscious, you need to get to the ER. Teeth are secondary at that point. I mean, things that you need to make sure the person's breathing, seeing, concussion. These are the high level things. Okay, so now take me through the sequence. So how does somebody seek care? You're at the baseball field or whatever. You have the tooth. You're fortunate enough to find it. You put it back in as best you can. You rinsed it off. Where do I go next? Do I rush to the ER always? It seems to be just a tooth. Everything else seems to be intact. Where would somebody seek care?
Yeah, that's kind of one of the more frustrating things that parents experience, and we as healthcare providers also. Emergency rooms are rarely equipped, staff-wise, and with the equipment that's necessary to maintain what we call dentoalveolar trauma, which is where a tooth or teeth get knocked out. Ideally, to have a relationship with your dentist, okay, or a dentist in your community, or an oral and maxillofacial surgeon that you can contact right away. I can't tell you how many personal friends that I have that might call me after sitting in the emergency room triage bay for 4 to 6 hours before they finally realize how ridiculous that it's getting, and they give me a call on the phone, and we can meet them down at the office and handle their condition, and or their general dentist. Most of the time, a Ball's tooth, which is what we call a situation where a person gets a tooth knocked out, which happens frequently. That condition is best treated by your general dentist. They need to not only be able to, or not only are they trained to and capable of reinserting the tooth in the ideal position, but also your subsequent care. In other words, is the tooth's survivability reasonable? Is it not? They can make judgment calls as to what lengths need to be provided you as a patient for weeks and months as well as years to come in order to either identify problems that are developing from that injury or to prevent them. And so that sustained relationship is a critical one.
So it's kind of interesting you say that. So if somebody's out there with a suspected jaw fracture or maybe a cheek fracture involving teeth, you as an oral maxillofacial surgeon can see them initially, triage it, take care of it, verify where they have their, again, they're not life-threatening injuries, but you can manage that. You can manage a broken jaw from A to Z.
Sure. And, oftentimes we do manage those patients as what we call an outpatient within our facility. However, when we start talking about a true skeletal fracture, a person with a broken jaw, for instance, or if they have that numbness, that telltale numbness of their lower lip, chin, cheek, and they can feel some actual mobility of that skeleton, that would be wise to seek emergency room evaluation. In those instances, the person would be evaluated by the emergency room physician. Routinely, a CT scan would be obtained and allow them to identify that level of injury. It's very interesting. That would then trigger what we call an emergency room consultation, where the emergency room physician would contact the oral and maxillofacial surgeon on call. So in many instances, the outcomes are just the same. It just is a little bit more of an elaborate process to go through the emergency room. And as we all know, emergency rooms are becoming used more and more as primary care facilities. People are going there for everything. Cold and ingrown toenail,
Sure.
Any of those aspects of things, and sometimes it gets in the way of people who do have some traumatic injuries that belong there. So it always helps to have contact.
Great. So let's fast forward a little more. So now we've gotten through the initial, you'd stabilized. Tell me, most often, I'm hearing and dealing with front teeth. That's who, you knock out a front tooth. What do? What is currently, what is your treatment? Obviously, if somebody knocks out a front tooth, how are you managing that? What are the options? What should people be looking for from their oral surgeon or dentist or whoever?
Sure. Yeah, there are a couple of primary issues that kind of deal with what we call the survivability outcome of those teeth that are lost. One of them is the age of the patient. The younger a patient is, the more open the pulp canal is of the root of a tooth, and so the survivability is much better for a youngster in those cases. Now, the second thing is time out of the mouth. Now, there are a number of different mediums or liquids that we can use. A balanced salt solution, milk is one, saliva is another, where teeth can be placed, and that protects them, keeps them from drying out. But nothing is better than to try to reimplant the tooth. So, if you're even if you're a little squeamish, and you're a dad or a mom out there in the baseball field, you see that tooth get knocked out, try to recover it, try to replace it, and then immediately contact your dentist so that they can evaluate that. Now, one of the things that the dentist will do is assess the amount of time that tooth is out of the person's mouth, and basically the positioning of the tooth once it's repositioned. The challenges that we have in today's environment is not just whether we can get the tooth to take immediately, but what is the long-term overall prognosis of that tooth. Even though a tooth may be replaced and repositioned, in many instances a tooth will ultimately die or be lost due to conditions that we call internal or external resorption. And these may happen years after the traumatic incident. And the frustrating part of that is, in many instances, when insurance comes to play, the patient, their funds or their assets in dealing with that have been exhausted. And so the question that comes up is, at what point do we give up on the tooth and go with an ultimate dental implant replacement of that lost and missing tooth? And in many instances, the tipping point may be the magnitude of the bony displacement that's happened in that area. If there's a significant crush type of an injury, we know the blood supply is going to be compromised, and ultimately the tooth is at great risk for loss. Now, so close assessment, timeliness, time is of the essence on that, but the close assessment of the age, the size of the pulp canal, the displacement, the time out of the tooth, and then subsequently how long it took that person to come in for management before they were assessed and managed. At some points, the decision is made to extract or remove the tooth, graft that area with some bone product.
So it replaces that bone. Okay, that's the crushed or whatever.
It's been lost or crushed, and maintain the bone in that area in order to make them a candidate, or do what we call site development or site protection, to make them a candidate for a more aesthetic and positive dental implant outcome.
But most of the time, you can replace teeth. I mean, in vast majority of time, if somebody's lost a tooth or two, the take-home message is you can put implants in there, you can replace it, you can make them pretty again and get them ready for homecoming or whatever their wedding is and all that kind of stuff.
Absolutely. I mean, that is kind of where we are in the state of the art of things. But first and foremost, we try to instruct the parents and the loved ones and just the individuals that are involved in those kind of wild little injuries where suddenly, boy, there comes the basketball and the teeth are out. Put them back in immediately. Contact your dentist. Get a hold of a professional that can help you, that's trained to identify and recognize tooth anatomy, tooth location, bite, what we call the occlusion, normalizing that and stabilizing that, and then having them follow you so they can give you appropriate advice as to whether or not it's time to bail on the reposition tooth.
Sure. Well, I know you've been doing this for many years, so you've seen a lot of this. I do have one last question for you. If somebody is to take a basketball to the face and they were to lose 1 or 2 or 3 teeth, does the tooth fairy still give you money for it, and is it more or less than if it was a baby tooth?
That's a tough question. I'll kind of Google that one to check and see what.
Okay. Well, the jury's still out on the tooth fairy, but I really appreciate your time. I appreciate your insight. I think people to get those teeth back in, get through the squirminess and get that tooth back in is very good advice. I really appreciate Dr. Tillery. Again, it's always a pleasure. Thank you.
Thank you so much.